So just going through the different ages, what are some of the symptoms we see in infants? Colic, inability to transfer, reflux, spitting up, choking, gagging, nursing all day long, early weaning from the breast, unable to hold a pacifier, high vaulted palate, falling asleep at the breast, clicking, smacking, popping noises, swallowing air, hard belly, leaking milk from the corners of their mouth, inability to use a bottle. All of these are huge things that we see and that I hear on a regular basis from moms. But then I also hear a lot of problems from moms. My nipples are flattened, creased, turning white, blanched, lipstick shaped. They get plug ducts constantly, mastitis, thrush, difficulty breastfeeding, and then on the other side, you actually believe it or not, you get anxiety, feelings of guilt, depression. Moms who wanted to nurse but were unable to nurse have twice the risk of postpartum depression because they feel like they can't take care of their child. And it's like, this is the only thing I can do for my child at this stage. So there are tons and tons of problems. In the toddlers, we see that difficulty transitioning to foods, solids, choking, gagging. I have parents who've told me my child turns blue 2 or 3 times a day and we have to do the Heimlich maneuver all the time. My child will only eat these 3 foods. They can't eat. They're messy. We are unable to get any solids in. Believe it or not, snoring and delayed speech. If that tongue was not in the roof of the mouth and didn't grow and develop the face, these kids can already be snoring. In adults, we talked about it, they can have headaches, migraines, jaw problems, snoring, sleep apnea. So think about some of these issues in adults. If their face didn't grow right, they're going to potentially have a smaller airway. So they're going to be holding their head forward. And how much of now, because of the tongue tie, their face grew improperly and didn't develop the airway, and now they have other physical problems because of how their airway developed. So sometimes we can release this and help them upright their posture and open up their airway by moving their tongue up and forward, and that may improve some of their symptoms, but we have to be cautious. Adults, they're more complex. There are more things going on in adults.